Thank you again for the kind introduction, Dr. Levi. Good afternoon. I am Adriana from Texas Tech University Health Sciences Center in El Paso, Texas, and my project is entitled The Impact of Cardiovascular Disease, a literature review of the All of Us research program, and preliminary results of the structural heart disease risk in the Hispanic Latino community and All of Us research project. And I had the honor of working alongside Dr. Cohn from Hunter College, New York, as part of the NIH All of Us research program's 2022 MSRS experience. Next, please. None of the authors have any relevant disclosures. Next, please. Historically, women, older adults, Black, Indigenous, and other people of color have been underrepresented in cardiovascular studies. The All of Us research program strives to be a solution to this by creating a demographically and culturally diverse research cohort that includes people who have been and continue to be underrepresented in biomedical research. As a member myself of the Hispanic population and someone who has spent the last 10 years exploring the field of cardiology, I see my involvement as a participant and researcher of the All of Us research program as a social responsibility to help address gaps in minority population health and cardiovascular research. Next, please. For that reason, I set out to conduct this project in two parts. First, we performed a literature review of all articles and abstracts that have been published on the All of Us focused on cardiovascular disease. Next. Then we summarized our literature review findings to get an overview of the cardiovascular risk profiles of all of us participants. Next. We also launched an All of Us research project looking at the risk of structural heart disease in Hispanics. Next, please. In regards to our literature review, next, we performed an extensive database search from May 2017 to May 2022. We extracted 26 articles in total using two strategies. First, using 3 search terms on Google Scholar and PubMed. Second, by manually examining the reference section of past reviews. After examining and eliminating studies with incomplete data, we then had 14 articles in total. Next. We also used the Simpson's Diversity Index to measure community diversity, and the algorithm is shown in the bottom of the slide. Next, please. In regards to our registered All of Us research project, next, we gained access to their registered tier dataset V5 and created 3 concept sets based on demographics, procedures, and valve disorders. We also created a cohort of only Hispanic participants and excluded participants who did not identify as Hispanic or did not report a race or ethnicity. Then we transferred our data to Jupyter Notebook for analyses, and we used the following 2 Python snippets. Next, please. You can find our registered All of Us research project in the research projects directory, or you can also scan the QR code on the right side of the slide. Next, please. Results. Figure 1 demonstrates 2 pie charts. The one on the left is based on the average percentage of ethnic populations based on the US Census data, and on the right, the average percentage of all of us participants per ethnic group in our literature review. There are minor differences among the Asian population in the All of Us at 2.9% versus the US Census at 5.9%. Next. The Simpson's Diversity Index score was higher in our literature review compared to the US Census, which indicates a higher diversity and a more even population distribution in the All of Us research program. Next, please. Figure 2 highlights how majority of articles on the All of Us research program have been recently published in peer-reviewed high-impact journals. As well, more than half of the studies report ethnic-specific analyses, and precisely half of the studies report sex-specific analyses. Next, please. Figure 3 demonstrates a higher cardiovascular risk profile among white participants, partly due to the high percentage of white population in each study in our literature review. Additionally, among The minority populations, participants that identify as Black present with higher rates of cardiovascular diseases studied thus far in the All of Us, and Hispanics have the second to highest cardiovascular risk profiles, and Asians have the lowest cardiovascular risk profiles. And additionally, we see here in this figure that female participants have more than 50% of cardiovascular disease and risk factors compared to male participants, except dyslipidemia. Next, please. Figure 5 and 6 show a descriptive statistics of our registered All of Us research project, which cohort mainly consists of female white Hispanic participants within the age range of 18 to 44 and a common past medical history of hypertension, abdominal pain, and chest pain. Next, please. Through our literature review and registered All of Us research project that we have presented today, our findings can potentially address gaps in minority population health and cardiovascular research, can also provide an overview of the types of studies that have been published on the All of Us, and inform current All of Us researchers of cardiovascular diseases that have already been investigated. Our project also tries to encourage researchers to perform both sex-specific and ethnic-specific analyses, which are unfortunately not performed in all of us research program projects. And our project also tries to confirm that the All of Us research program is actually building a diverse and representative cohort of participants compared to the US population based on the US Census data. Next, please. While conducting our study, we faced two limitations. One, that values of less than 20 are reported as 20, and we found incomplete data on 5 out of the 14 studies in our literature review. Next, please. To obtain more accurate rates of disease per ethnic group, our next step will be to account for the uneven misrepresentation of ethnic groups within the 14 studies of our literature review by performing proper adjustments on the weights of each ethnic group, as well to as well as to perform further analysis of our All of Us research project and publish our findings for the benefit of the medical community and its patients. Next, please. Here are our references. Next, please. If you enjoy the presentation, please vote for a project at the People's Choice Award. Our project can be found on booth 6 under my name, Adriana Mares. Next, please. I would like to acknowledge every mentor, colleague, and my family who has supported my passion for this project. Next, please. And lastly, but definitely not least, we want to thank the investigators and especially the current and future participants of the All of Us research program. Next, please. Thank you for listening.
Thank you, Adriana, for your presentation. Next, we have